This is a Fox News alert. Major news in the race for a COVID-19 vaccine. Drug giant Moderna announcing their vaccine trials show that it is nearly 95% effective, joining Pfizer as a leader in the push to end this pandemic.
Wow, that is great news. Health and Human Services Secretary Alex Azar joins us now with an update. Mr. Secretary, this is not totally surprising. We haven't gotten the details yet, but now we have two vaccines. When can the American people expect to be able to make that choice, which one they want?
Well, thanks to President Trump's Operation Warp Speed, that choice is coming very soon. You know, this is really a historic day. This is the vaccine that President Trump partnered with Moderna on January 13th at our NIH labs, and now over 90% effective vaccine in one of the largest clinical trials ever. So now we have Pfizer, we have Moderna, and thanks to President Trump's vision, we've been making both of those and 4 other vaccines at commercial scale production. So we believe we'll have enough for 20 million Americans to get vaccinated in December.
Okay. Mr. Secretary, last week when the Pfizer news came out, where it was 90% effective, stock market went up like 1,000 points that day. Clearly, this is probably going to impact the stock market as well, but it's going to impact people's lives because people are looking, hey, I can either get the one that's 90% effective or the one that's about 95% effective. But the problem is I've read that the Pfizer vaccine's got to be stored at 70 degrees below zero, and a lot of places don't have that kind of facility, whereas perhaps the Moderna is easier. So fast forward to when this is mass produced, will somebody be able to go to the Walgreens and say, give me the Pfizer or give me the Moderna?
That's a great question, and the Moderna one is more flexible. It can be kept in regular freezer or refrigeration, so it's going to be amenable to that program we announced last week, going to your local chain or community pharmacist and getting vaccinated. The Pfizer one's going to be really good for big institutional vaccinations, say a whole hospital setting, several nursing homes at once.
Mr. Secretary, what do you say about schools? Because I know that Governor Cuomo's even said if it doesn't get up to 3%, schools can stay open. But once it hits 3% in New York, schools have to close. But he said, let's look at each school individually because some are hot spots and some are not. And I think this is an issue that Americans, Democrats and Republicans would all say, keep those schools open, at least the majority. What do you think?
It's ridiculous to close our schools. It's not driven by science and data or evidence. Look at the Europeans. They're experiencing 45% more cases per capita on a daily basis than the U.S. They are making it a priority to keep their schools open because the schools, K through 12, universities, these are not major vectors of disease transmission. Our workplaces are not. Our airlines are not. It's indoor gatherings where we let our guard down, don't wear a mask, don't keep social distance, and our governors keep going at our schools and our kids, and there's real harm to our kids, their mental health, their physical health, their emotional well-being. We shouldn't be closing our schools.
Right, but someone's got to get that message to Governor Whitmer. She has closed high schools and colleges. They have to go remote. Indoor gatherings limited to 10, outdoor to 25. And it caused Dr. Atlas to come up and say people should revolt, not get violent, but revolt and say this is not acceptable. They had the strictest lockdown. Their numbers are going up like other people's are going up. What do you say to Dr. Atlas, who said that to the governor?
Well, I'd say to everybody, be guided by science and data, and the data supports keeping our schools open. Look at the Europeans. Like I said, they are about as cautious and as scared of their shadow as anybody could be, and they're keeping their schools open because they know schools are safe. You can run them safely. Any institution where you have leadership following good public health guidance on how to keep social distance, wear face coverings, we've shown this can be done very safely, and these institutions do not need to be shut down to keep us safe.
Right. Mr. Secretary, real quick, 10 days from today is Thanksgiving. You know, a lot of college kids are going to be coming home. I just read that Boston University is suggesting people not leave campus. They have a Friendsgiving. Other schools are ending in-person learning at the Thanksgiving holiday as well. They're just going to go home. But for people whose children are away, for them to come home for a couple of days, what sort of precautions? Because, you know, my wife and I have been talking about whether or not we see our own kids over Thanksgiving for the last 2 weeks.
Well, you want to look at what's going on at that school, what kind of case positivity they're having. Is there a lot of infection there? At most of our universities, we're not seeing it. In fact, our universities who have weekly testing have some of the lowest case rates of any places in the country, so your kids may be safer than you are, frankly, in getting together. But look at those circumstances and just use good common sense. Look at coronavirus.gov, cdc.gov for our best advice on how to steer through Thanksgiving and Christmas and what the different mitigation steps are you can take at home. The very common sense things like opening the window if you can, eating outdoors if you can, minimizing the number of folks depending on your own vulnerabilities. But just look at the circumstances and use common sense.
All right. Thank you.
Okay, Mr. Secretary, thank you so much.
Thank you.